Good evening. My name is Brendan White. This is a demonstration of a traumatic patient assessment. EMS was dispatched to a local community where a person has been reported fell from a tree. It was reported that the person fell approximately 5 feet and landed on his foot. BSI, or C is safe. Mechanism of injury of number of patients, one. At this time, I am not considering additional help and I am considering C-spine mobilization. I'm not going to move towards a patient in the line of vision. Sir, if you can hear me, please do not move your head. I'll ask my partner to come up with manual inline stabilization. At this time, I will assess the patient's level of consciousness. Sir, can you hear me?
Yes.
How are you doing today, sir?
Very bad.
What is your name?
Richard.
Do you know what date it is?
August 34th.
Okay. So my patient's airway is patent. My patient's level of consciousness is alert and oriented to person, place, time, and event. And I'm not going to go into breathing. Looking at the rise and fall of the chest, looking for adequate depth, adequate rate. I'm also going to auscultate lung sounds. Assuming that my patient has been in stress area, thoracic area has been exposed. There seems to be some inadequate breathing. So at this time, I will use a non-rebreather mask and I'll give my patient 10 liters of high oxygen while I move on to further assess the patient. Next up in assessing the patient is looking at my patient's skin color, taking the skin to check for dehydration, checking for capillary refills, also bilaterally checking the peripheral pulses, checking for rate and regularity. Patient's pulse is beating at 80 beats per minute. Also taking a quick rapid scan, looking visual scan of the patient, looking for any some forms of bleeding. There is none, so I'll now go on to doing a quick rapid scan. Palpating the head quickly, the face, the neck. At this time, I will use a C color. Alright, C color, my patient. Making sure that it is secure, proper in place. While doing so, I do a quick palpation of the clavicle, thoracic area, the stomach, pelvic area, lower extremities. My patient groans. There seems to be some form of the deformities to the left tip fib. Checking for PMS. Sir, could you please squeeze my hand? Okay, PMS is intact. At this time, I'll identify my patient as a corrected patient. I'll transport this patient to the hospital. I will use a lumbar board. To get the patient onto the stretcher. I'm now going to wrap this patient on the side of the injury. While the person at the head comes.
Alright, so rolling on 3. 1, 2, 3.
Doing so, I'm palpating the posterior portion of the thoracic area. Also, auscultating.
Alright, so rolling on 3. 1, 2, 3.
Properly position position the patient on the backwards, up and down. Secure the patient. At this time, I'll start my secondary assessment. First, I'll go into my OPQRST. Before doing that, I'll expose the patient to lower extremity, where I will split the injured extremity or immobilize the patient extremity. As stated earlier, I'll go into my OPQRST. Sir, did you start to feel pain in the lower extremity upon impact of the fall? Was anything make you feel better or worse? No. Sir, can you describe the quality of pain you're feeling? A sharp pain, stabbing pain, or burning pain? Burn. Okay, sir, can you tell me, is this pain constant in your feet? Does it move from up and down, or is it easily localized to one area? Localized. Okay, on a scale of 1 to 10, 1 being the lowest, and being the highest, could you rate the pain of the scale of the pain you're feeling? 8. Okay, sir. And this pain, does it go away? Does it come back? Or is it constant? Constant. Okay, sir. Thank you. Are you allergic to anything? No, sir. Are you on any medication? No, sir. What was your last meal? What did you eat? What was the last time you ate? Rice and beans and chicken. Okay, and what was happening while this happened? Was climbing a tree, sir. Climbing a tree. Okay, sir. Thank you very much. Now that I have obtained a sample history and OPQRST for the patient, I'm now going to go into my secondary assessment, further into my secondary assessment by doing a detailed physical examination. Palpating again, patient, sir. Looking for deformities, contusions, abrasions, tenderness, lacerations. Checking PMS. My partner and I are going to go now take a full set of vital signs. Part of the pupillary reaction. Using the pen and check here, looking for CSF. My patient is with blood pressure check. But at this time, I take the patient's GMR and also get the patient's temperature, core body temperature, which is at 35.6 degrees Celsius. Pupils are firm, equal, regular, growing size and reactive to light. SpO2 at 98. Strong bone impulse at 88 beats per minute. No sign of dehydration. Blunt cap refill. GMR at 4.5. BP at 120/8. While I'm going to the hospital, we'll continue to reassess this patient every 5 minutes, get into the nearest trauma center as quickly as possible. And that concludes my demonstration. Thank you.